A stroke is a brain attack which occurs when blood flow to an area of brain is cut off. When this happens, brain cells are deprived of oxygen and begin to die, hence abilities controlled by that area of the brain, such as memory and muscle control, are lost. I met a 68-year-old Rebecca Padat, a mother of 12 children who currently stays in Gayaza. Rebecca has been suffering from a stroke since early June this year, and she narrates to me her ordeal. It started as hypertension about 10 years ago. Sometimes my pressure was high, sometimes low. I used to take hypertension drugs and treatment until last June when I suffered a stroke, she tells me. When her situation was not improving, Rebecca was advised by doctors in Tororo to try Nakasero Hospital for further treatment. One day, after I left the hospital, like at around 5 p.m., I was hit by a stroke. It paralyzed one side of my body, mostly my hands and the neck. That's when I was brought to Nakasero. She tells me. At Nakasero Hospital, the doctors then found out that she had a stroke and a blood clot in the brain. Rebecca was thereafter taken to Stroke Rehabilitation Center to receive the only viable treatment, physiotherapy.
Rebecca, when he was brought here, was after discharge. After being discharged from one of the hospitals where she was admitted, she was brought in here when she was in a wheelchair. And after receiving the therapies after some months, she gained her strength in the weak side, slowly by slowly. However, this had to take some long time after a series of sessions, and also the counseling she got from this place helped her, and also the will she had, plus the good company at home also assisted her to the stage where she is now.
Currently, after receiving the therapies, Rebecca is able to walk, can ably carry out her day-to-day activities. But what exactly happens when one is attacked by a stroke?
This is a condition which is caused by shortage of blood to the brain, either by a blockage or when the blood vessel bursts, taking the blood to the brain, and then the brain shuts up and the person suffers a stroke or paralysis of one side or either both sides of the body.
The causes of stroke are majorly based on the type of stroke experienced. However, the most underlying risk factors include hypertension, sickle cells, diabetes, smoking, obesity, among many others. So who is at risk?
Currently in Uganda, all people are at risk, because even the children with sickle cell, they are at risk, they get a stroke. And people with high blood pressure, they are at risk. People with the diabetes, they are at risk. People who smoke, they are at risk. And people who drink a lot of alcohol, they are at risk. And those people who do not exercise and they are obese, they are also at risk.
Fortunately, stroke is treatable and can be prevented.
Stroke is treatable, is preventable. So if you want to prevent yourself from suffering a stroke, you have to make sure you go for regular checkups. They have to monitor your blood pressure at least every 3 months. You have to check for your blood sugar at least also 3 months. Then you have also to check for what we call cholesterol. Cholesterol is the amount of fat running in your blood which blocks the blood vessels. This one can be checked after every 6 months. Then you can also try to exercise regularly if you want to prevent it. If you are smoking, try to get counsel such that you can stop smoking. If you are drinking alcohol, try to also stop alcohol taking such that you don't suffer this stroke.
The main symptoms of stroke include confusion, which presents trouble with speaking and understanding, headache causing altered consciousness or vomiting, numbness or inability to move parts of the face, arm or leg, particularly on one side of the body, trouble seeing in one or both eyes, trouble walking, including dizziness and lack of coordination. Stroke is one of the common neurological diseases among patients admitted to the neurology ward at Mulago, Uganda's National Referral Hospital, accounting for 21% of all neurological admissions. At the Stroke Rehabilitation Center, about 12 patients are received on a daily basis. World Stroke Day, observed on every 29th of October each year, raises people's awareness on stroke and what can be done to combat it. Uganda will hold its celebrations at the Stroke Rehabilitation Center under the theme, "What's your reason for preventing stroke?" I'm Dennis Wanyala reporting for Urban TV.